Hello, my name is Brittany. I am an NP student at Youngstown. This is my patient Taylor. I am going to do a heart and lung assessment. Hi Taylor, my name is Brittany. How are you today?
I'm good. How are you, Brittany?
Good. So I'm just going to start by standing at the side, have her sit really tall, and check for heaves and pulsations, and none of those are noted at this time. I am going to inspect and palpate the pericardium area for two different positions. So I'll have her start by sitting, and then we'll do it laying. Also, I need to point out her apex, her sternum, and her sternal borders. So her apex would be down here, her sternum is here, and then this would be her sternal borders. Okay, so I will have you go ahead and lay down. And it will be left clavicular, fifth intercostal space. So I'll find her clavicle and then count down 5 ribs to the fifth intercostal space. And there are no thrills noted. Okay, and then I will have you roll onto your side, so it would be your right side. And also the same for that. And still no thrills noted for that. You can go ahead and sit up. And I'm just going to listen to your heart sounds. For this, I'm going to check for S1 and S2. Make sure there's no murmurs. So first is going to be her apical. And then pulmonic. Erb's point. Tricuspid. And her mitral. And S1 and S2 was noted at all of those. There was no splitting and or murmurs heard. With her respiratory, there was no variations in intensity, pattern, quality, or location. When she spoke either, there was no variance. Okay, I will go ahead and inspect and palpate the chest. And for this, you're going to stand really tall, and I'll assess for retractions and equal rise and fall for this. So I'll do that laterally and posteriorly. And then also find your trachea, so if you can go ahead and look up for me. I'm just going to palpate along your neck here. So this is her trachea all the way down to her notch, and then a little bit farther is the angle of Louis, and those all feel normal. And so she, her breathing pattern is normal. No active distress noted, no nasal flaring. I am going to have her lift her arms up and measure her AP and lateral diameter. I'm just going to go right under your breast line. So her AP and lateral ratio should be 2 to 1. So her AP is 16. If you could just turn just a little bit that way. And her lateral is about 6.5. So that's pretty close to the 2-to-1 ratio. You can see her clavicles. Those are easily palpated. Okay, I'm going to listen to your lungs. You also can note, you can feel her ribs till about her breast line, and then lower down we would check for that. Okay, so I'm going to take a listen to your lungs. Deep breath in. So there's no adventitious sounds noted, no crackling, wheezing, ronchi, there's no stridor, and no friction rub when I have you turn that way. Forward. Like that, yeah. And then listen to you on the side here. Deep breath. Okay. Also no adventitious sounds noted there. If you could just back around this way so I can do this side. Switch your feet back there. Deep breath. Again. And one more. Okay. No adventitious sounds noted there. Go ahead and face the wall for me. And then I'm going to listen to the back. Deep breath. And no adventitious sounds on the posterior side. You can stay seated that way. I'm going to check her thoracic expansion. So I'm going to find her ribs and the base of them. And then I need you to take 3 deep breaths for me. And her deep breaths are symmetrical. There's no crepitus noted. And then I'm going to percuss the lung fields. And those, for the most part, were pretty dull. And then I'm going to measure her diaphragmatic excursion. And then I want you to sit really tall for me. I'm going to just find the bottom of her scapula and have her take a deep breath. And then measure that. Take a deep breath for me again. I lost my... Which was about 3 inches. And then I'm going to check for tactile firmness. Go ahead and say 99 for me. 99. Can you say a little bit louder? 99. Okay. That was symmetrical when she said that. You can go ahead and turn around for me. So like I had already stated, there was no adventitious sounds in terms of crackles, ronchi, wheezing, or friction rub, and her vocal resonance was normal. I think that is all at this time. Thank you.